I'm absolutely delighted to be joined by so many people from around the world for this special event looking at how Kerala has been dealing with coronavirus better than almost anywhere else in the world. I've seen the list of participants for today, so I know how many people I regard as very close friends are with us now. Of course, it saddens me greatly that we're not together in person, but on the positive side, I'm able to keep you all on mute, and so I can't hear any heckling. I feel extremely fortunate at the best of times to be the Chief Executive of the British Asian Trust. It's such an incredible organisation driven by the British Asian diaspora and His Royal Highness the Prince of Wales, and supported by some of the most incredible people across South Asia to make the most positive difference possible for poor and marginalised people in India, Bangladesh, Pakistan and Sri Lanka. But times like this, when there's a global pandemic ruining the lives of hundreds of millions of people, I'm in an even more privileged position because I know how important our organisation can be. In 10 years, we've changed the lives of more than 4 million people, and we know we're needed now and in the months ahead more than ever. We're blessed to have a truly fantastic board of trustees, and I'm delighted that one of those, Lord Jitesh Gadhia, is moderating today's event. As I'm sure many of you know, Jitesh is a very influential member of the House of Lords here in the UK. He's had a hugely successful career as an investment banker. He's a board member of UK government investments, and he advises the highest levels of the British government. He's a great supporter of the British Asian Trust, and we all truly appreciate the time and support that he gives to the organisation. Before I ask him to take over, let me just point out a few things. I'm afraid this isn't going to be an interactive session. Everybody has had the opportunity to submit questions, and we will be monitoring the chat to see if there are other questions that come up. But Jitesh will be using the questions that have been submitted as part of the discussion. We will be keeping everyone on mute for the whole session. The event is being broadcast live on Facebook and it is being recorded. And after the discussion, we'll be showing a special video message from Prince Charles, our royal founding patron. I hope that's all clear and okay. And so without further ado, I'd like to hand over to Lord Gadhia, who will then introduce our most esteemed guests.
Richard, greetings to everyone and my own personal welcome to this webinar, which I'm delighted to be hosting on behalf of the British Asian Trust, with two very special guests from India joining us live, the Health and Social Welfare Minister of the Government of Kerala, Mrs. K.K. Shailaja, together with Mr. Shashi Tharoor, Member of Parliament, a former Minister in the Government of India, and previously Under Secretary General at the United Nations. A very warm welcome to you both. Before we develop our discussion further, I wanted to set the scene and share some observations and reflections. One of the ironic features of the COVID pandemic is that it is a truly global health crisis, touching virtually every country, yet it remains defined by national or local responses. As each country or state has navigated its own path, governments have invariably imposed varying degrees of lockdown, social distancing measures, and testing and tracing regimes. There have been almost universal struggles to source personal protective equipment and essential medical supplies. And every nation faces the increasingly painful consequences of shutting down entire economies and the associated impact on livelihoods. But the performance of certain countries and states stood out. Amongst them is undoubtedly Kerala, with 35 million citizens amongst India's most densely populated states, and one of the most open and mobile societies in India, receiving 35% of income from overseas remittances and attracting 1 million tourists every year. So it was no surprise that Kerala became India's first state to receive a coronavirus case at the end of January this year from a student traveling back from Wuhan. But what is remarkable is that in almost 4 months since that first case, the total number of confirmed incidents in Kerala has been contained to just 1,003 as of the 27th of May, with only 6 recorded deaths. And for context, India overall has over 158,000 cases and more than 4,500 deaths. Although each country has hunkered down to address its own domestic challenges, there is clearly a lot we can all learn from international best practice, especially from across Asia, which is far more experienced at dealing with respiratory diseases like MERS and SARS. Certainly sitting in the UK, which is on course for 60,000 excess deaths, we feel this painfully and very acutely. From what I have observed of the Kerala model, it seems to be based on 5 essential ingredients. First, the timely action taken in January. Second, the decisive steps to introduce strict 28-day quarantines, active testing and compulsory contact tracing. Third, the existing healthcare infrastructure in place throughout the state, which could be readily deployed. Fourth, the social and community capital, including Kerala's famous literacy rates, which enable the state to implement all these difficult measures while supporting the most vulnerable in society. And fifth, the public trust and cooperation, which you have enjoyed, which provides the glue binding the Kerala model together. With that backdrop, I wanted to turn first to Minister Shailaja for her insights and comments on Kerala's standout performance. My first question is about the importance of having dealt previously with other deadly contagious diseases such as Nipah, another zoonotic virus emanating from bats, which you faced in 2018, and also variously Ebola, Zika, and swine flu. How crucial, Minister, was this prior experience in your preparations for dealing with coronavirus?
Thank you, sir. Definitely, our previous experience helped us very much this time also. When Nipah virus occurred in 2018 in Kerala, we all know it is a newly emerging zoonosis and it is not familiar to Kerala. Even in India, it appeared formerly in Bangladesh border once, and in world it occurred in 4 or 5 places only. And that virus came to Kerala 2018, and we were afraid at the first moment, but suddenly we started to fighting against it. We want to prepare a proper protocol to tackle Nipah problem, and we inquired everything in literature, and also we have contact with other countries, Malaysia, Singapore, etc., where it occurred previously. And with that experience, we framed a very good protocol for action and standard operating procedure also. The first important thing was to trace the contact of the infected people in that Nipah case. And we formed a very good contact tracing team here with the help of GPS and IT, etc. And also with the help of our field workers, we formed with the community medicine department, and we formed a very good contact tracing system in that Nipah period. And we traced all the contact, and at that time we started home quarantine. We are hearing that word, and we are familiar with that word at that time, home quarantining. And we started home quarantine with the help of local self-government. We asked the people to stay back their home. At the time of that Nipah infection, people were afraid of that thing. They don't know whether it is an airborne disease or how it is infecting to others, how it is spreading. And we have to teach people. We went there, that same village. I also went there and with the experts, and we taught them that this is not airborne disease. This will only spread through transfer only through direct contact, etc. No need to going away from this village. They are trying to fly away from that village to another places. They are afraid. All the people were afraid. If they flew to other places, we have to open other warfield in other places also. We want to contain that thing in that village itself. and we closed that village, and we quarantined that contact cases properly. So no spreading occurred. Only 18 people got virus, and out of which 16 succumbed to death. We can say 17, that one patient died earlier without the identification of Nipah virus. And after that, when we identified it, we sent them all to isolation in hospitals, and we saved two from the Nipah virus, and they survived out of that. And we contained it in a small place, and in a short span of time. Within 35 days, we are able to tackle that problem, to contain that virus. That is a collective work. All the line department assembled together, and with the help of health department, they were working at that time. We prepared the standard operating procedures for them also, how to correlate and coordinate these works. That is a very good experience to us, to tracing the contact, to isolation, and to treat, how we can treat without any medicine, proper medicine, how we can treat the infected patients. That was a new lesson to us. And from that lesson, we got some experience. And this time, a new virus, when we happen to hear about the new potential virus in Wuhan, it is spreading in Wuhan. We read the WHO communication that a potential virus is there in China, Wuhan. At that time, I called my health secretary, and we had a very good meeting, and we discussed these things. I am sure that I was sure at that time, definitely some students will come back from Wuhan to China, because in Wuhan University, so many Malayali students are studying there, and we started our preparedness at once. No one was back at that time from Wuhan. In January itself, January 18th, we happened to hear WHO's guideline and WHO's report, and some electronic media also reported about this new type of SARS virus. But at that time itself, we started our preparation. On January 24th, we opened our control room here, and we formed 18 expert groups to proper action, even the logistic correction and mental health and the contact tracing and treatment, everything. We have special team, expert team. We constituted a special team here, and we started action, and we prepared each and every districts to follow our guidelines, and they also opened their control room, etc. And the earlier preparedness helped us very much. That preparedness, definitely, it is in the base of our previous experience with the Nipah virus, and that helped us very much.
Thank you. Minister, I mentioned 5 ingredients which helped contribute to Kerala's success in my opening remarks. Are there important factors missing from that layman summary, or are there certain measures you would highlight as being more crucial than others?
Yes, you mentioned the timely action that I explained here, and the quarantine and other thing you mentioned, that also I explained, and the very good public health system. That is the most important thing, as you mentioned here. From 1957 onwards, our state was formed in 1956-57 period. After independence, linguistic states were formed in India, and at that time Kerala also formed as a state, and at that time we have an election, and elected democratic government came to power at that time. That the very first government of Kerala started the people-centered planning here, and we ended the landlordism here by land reformers, and also we have a very good reformment in the education sector, public schools for the whole population. We started building public schools, and also we started the public health system in each and every panchayat, the small unit of our state, in each and every local self-government. We have a very good primary health center here. There were some drawbacks, but we have primary health centers here. And that way we started the people-centered planning in Kerala. And now we have a very good public health system here. When this government came to power in this 2016, we again modified the public health system. We converted all the primary health centers to family health centers. Previously, only one doctor was there in a primary health center up to noontime for the poor public. And we changed it. We supplied 2 more doctors, and now there are 3 doctors. Not only increasing the human resource, but the infrastructure we changed a lot. We have the aim to convert it as people-friendly hospital and also high-tech according to the modern era. And also we want to reduce the out-of-pocket expenditure of the poor people, to give affordable treatment, to give free treatment for the poor people and affordable treatment for the middle class, etc. We started so many clinics in the primary sector itself. We focused on the preventive activities. In all our declaration, Alma-Ata and Astana declaration, the WHO and the UN wants to give focus on prevention of disease. But according to new situation, every part of the world is moving towards curation and specialities. They are not thinking about the primary healthcare and preventive part. Preventive part is the most important thing. Prevention and curative and rehabilitative, every part is very much important, but preventive part is the most important thing, we can say so. And we give important to preventive part. Within these 4 years, we were converting this primary health center to family health centers and more clinics. We started Shahsi clinics, that is for COPD, chronic obstructive pulmonary disease. And we are testing that in the primary level itself. And also we are screening the population for diabetic and also for diabetes and also for the hypertension. It is saying that, not saying, but it's the truth that Kerala is the diabetic capital of India. And India is the diabetic capital of world. Because of the new lifestyle, we are accumulating this kind of lifestyle diseases. And we decided to tackle that problem. And we are screening all the person above 18 years old for diabetic and hypertension. We are doing so many works like that. And that public health system is the most important thing. And also this social and community capital. As you know, Kerala is not a rich state. We can say so many financial problems are here, as every part of the world we are facing the financial crises. But in Kerala, the notable thing is that out of this financial crisis, we have a very good system. We have a very good socio-economic development here. And the old governments who came to power in Kerala continuously started to improve the socio-economic position of the status of the citizens. They are became the very poor people. We have a very good success in alleviating poverty alleviation, etc. And we have a very good socio-economic position here. We are not satisfied fully that we have so many problems nowadays also, but we have a very good system of socio-economic development here, and the high literacy and also very low infant mortality rate, such kind of indices in health sector also. And that platform also is also helping us very much to tackle the great problems. And people's trust and cooperation. We are working together. Shashi Tharoor MP is with me, and he is helping us very much in this field. He supplied so many new instruments in this corona period to tackle this problem. Even in the airport itself, he is arranging new things to trace the people, and also he is giving his MP fund to us. And together we are working here, working together. That is the Kerala model, we can say so. In front of an enemy, we all are in the United States. Some criticisms are there, that every time that will happen. But we are working together to tackle or to contain this cruel virus, we can say so. And that decentralized planning in Kerala, that's also helped us very much. Local self-government's power and their strength. In each and every panchayat ward, we have a very good committee to inspect whether the peoples are staying in quarantine or they are jumping, and they are watching thoroughly. This kind of system helped us very much. All you mentioned all the things, and no need to add any other things in this.
Well, your exposition has been great, and I can see on chat that certainly the emphasis on the public health system is one that many participants also agree with. And my next question to you is, I think also reflected on a question we've had from one of our supporters, Ashok Kalumpran, who is a Malayali living in UK, in Manchester, who, by the way, has sent his not only warmest regards, but huge congratulations on the success of the Kerala model. But looking forward, with the Indian lockdown scheduled to lift this weekend on the 31st of May, what do you worry about most in maintaining the track record that you have established? And one obvious issue often highlighted is citizens returning from the Middle East or Gulf states, or indeed across interstate borders. And there is a concern that's been expressed for the migrant workers who are obviously in a very difficult position.
Is when the lockdown lifted, again the problem arises. The first part, we flattened the curve, and we have a very good result out of that. And our case fatality rate was below 1%, means it is 0.5%. And also the curative part, we can say that the recovery rate is also very high in Kerala, was very high in Kerala. In the first part, from Wuhan and from Italy and other part of the world, we got 512 cases before May. And all the patients discharged from the hospital, and out of which only 3 deaths have happened. When the closed cases, we got only only 3 deaths happened at that time, and so the case fatality rate was very low at that time, and we tackled the problem successfully. But after that, when again the lockdown lifted, again the flow occurred here. People are coming from outside, from abroad, and also from other part of our own country. And from abroad, they are coming from the epic centers, where the virus density is very high, from Gulf countries and other parts. And inside our country also, there are some epic centers, the big cities like Mumbai, Chennai, etc. The virus is spreading there, and that also becomes some epic centers. Our country is struggling hard to fighting against the virus, but that great cities are the virus dense cities, and people are coming back from that place to Kerala. Thousands of them are coming. By flight, more than 1 lakh people came, and by road also, and 4 lakh people registered to registered in a non-Keralite cell to came back to come back, and some of them came back, and others are waiting for our not to come. We agreed the people to come back, but the second time the waves are rising the second time, and from the second coming, we can say third coming, Wuhan and Italy, and after this is the third coming, and this third phase we got 491 cases, new cases up to 27th, and out of that also 3 deaths occurred. One person drive came by road, and when she reached here, the next moment she died, and that also added to our death toll. She is a Keralite Malayali woman, and when she reached here, she was so sick and she died at once. And that way, the death rate, number of the deaths increased to 6. Yesterday, it was counted as 6. And that also, the fatality rate is also low now, but we are worried about that. So many people are coming with the high density of virus, the sick condition, and when they reach here, we are not able to save them. Our hospitals are struggling hard to save the people. We saved a 93-year-old person out of corona, and also 88-year-old lady, and above 70 years, more than 50%, 15% are above 70, and we saved them all. Only someone who have comorbidities succumbed to death. That was our history. And now in present day, the more comorbid persons are coming here, and more severe cases are coming here. And it is our responsibility to save them. And that is the challenge in front of us. But we are fighting, we are enthusiastic. When we got them properly in the proper stage, we will save them definitely. But if they become so sick, what shall we do, Kerala? And the graph is coming, there is a hike in the graph, but it is expected thing, unexpected thing that's happening here. It is expected. We expected this much of cases, not this much, little more. But the graph is not touching that point. that is a good thing. And we are eagerly watching. And we should have to flatten once more this curve. We are working hard for that.
Thank you, Minister. I know Shashi is waiting very patiently, but I wanted, Shashi, if you'll excuse me, just to explore one last theme before I come to you with the Minister, which is almost crucially related to the last point that she made about dealing with these successive waves, as she said, the sort of third wave that you're now facing, and also link it back into our experience in the UK. Now, we've seen across the world how the testing, tracing, and isolation is so crucial to suppression of the infection rate. And when I look at the hyper transparency and the level of granular detail which you report on a daily basis in Kerala, and for those who haven't seen it, I would strongly recommend that you visit the following website, dashboard.kerala.gov.in. I wonder if the secret to being on top of this virus is really, and you express it when you speak, a compulsive obsessiveness about hunting down the virus and not giving an inch to transmission. It's really a war footing. Even the headline of your website says COVID-19 battle. And just to relate that back to here in England, the National Health Service has just launched its test, trace, and isolate system only yesterday, with more details being revealed today. What can we learn from Kerala's system, and what advice would you offer to the UK?
Are you asking me?
I'm asking you, Minister, before I turn to Shashi.
I think you are mentioning Shashi Tharoor ji. And pardon, what is the last? Advice to UK. Oh, who are we to advise to a great country like UK? We are only a small state in India, but there is a different pattern of health system here. Actually, when we are converting our primary health center to family health center, I am using that method in UK, that general practitioners, GP surgery. When I visited UK, I visited GP surgery also, and that spacious building, and also the nurses pre-checkup and all other things in that the NHS system in UK. We took something out of that to frame our family health center here. Not only from UK, we have something from this Cuba's family doctor system, and we have a very good discussion with eminent personalities and the persons of with great experience in health here. and we framed a family health center system for us. And in UK, that NHS system was good, but I think the difference is our public health system. We are going to the grassroots level, and the treatment is affordable to all the population, not only the poor people or but the rich people. The all of the population are getting affordable treatment here. Someone have to pay some affordable amount for treatment, and so in some private hospitals it is too high, but in government sector there is treatment for this middle class and also for the lower class. In that way we can give protection to them. And the one thing is to in our mind we have to think one thing, that we have to remit more money for these poor people sector, and to improve the health condition of the most important part of the, or the most high part of the population, that is the grassroots level, the people who are living in villages, and also in cities, the poor people, they are working hard. And that is the first thing. The another thing is the collective work, the pre-preparedness. We have to, if we want to tackle any problem, we have to start our own preparation, not looking to others. We can take experience from other part, but we have to prepare our own preparation. In this coronavirus tackling, we the most important part is the tracing of the positive cases, tracing of the virus. We have to trace that, and isolation. The most important part is to break the chain, the transmission, human to human transmission. We have to cut the relationship, and we have to break the chain. We started a campaign on break the chain here, hand washing, and also wearing mask, and also to use social distancing, etc. In previously, it is not a system to wash the hands occasionally, but we insist the people to wash the hands when they come to their home, return back to their home outside, they should definitely wash the hand. And in front of every offices, there is a kiosk having sanitizers and soaps, etc. And we developed that system. Keeping the social distance, then only we can contain this virus. The most important thing is tracing and testing, isolation, giving treatment, and also breaking the chain of the transmission. That is the most important thing. If we can do it systematically, we can win over this virus.
Thank you, Minister. I should read out, I think, something that sums up my reaction to your response there. It's from Priya Agrawal, who says, "Ma'am, your humility is so refreshing. The reality is that Kerala has made the whole handling of the crisis so simple, when one can see how complex the connection of the dots has been." So on that note, let me turn to Shashi. Before we discuss the experience of Kerala, I wanted to ask you a broader question. We have many participants online who are friends and well-wishers of India, anxious to understand the overall picture. I recognize you're not in government at the moment, but as a parliamentarian, are you able to provide us with a sense of the overall impact of coronavirus on India and your assessment of the national response so far?
Well, it's been pretty devastating, Jitesh, and I must say that Kerala is very much an outlier. I might add that I'm in opposition to both the government in Delhi and the government in Kerala, but I don't hesitate in paying tribute to Health Minister Shailaja, who's done exemplary work, and to the overall approach of Kerala state, government, and society, because everybody has chipped into the success story in Kerala. Nationally, we've had some very severe problems. I must say that the only sort of thing that the opposition found to applaud was the government announcing a lockdown. We felt they did it 10 days too late and with not enough notice. We had been calling for something from mid-February, when the leader of the Congress party, Rahul Gandhi, pointed out that the situation needed to be taken more seriously. But as late as the 19th of March, India was still exporting personal protective equipment, and as late as the 23rd of March, Parliament was still meeting. And many of us felt that the reason we were being asked to do that, including putting ourselves cheek by jowl with fellow parliamentarians, was because the government needed to keep open the state assembly in the state of Madhya Pradesh in order to bring down the Congress government there in a vote of no confidence, which would not have been possible had they admitted that the situation was more serious nationwide than they were prepared to admit. The moment that government had collapsed, the Prime Minister announced a lockdown. But then he did so, as I said, about 10 days too late, but with no notice at all. Ironically, he'd done a sort of test run, giving us all 48 hours notice to have a people's curfew on a Sunday, which obviously didn't take too much of effort. And yet, to have what was initially announced as a 21-day lockdown, which has since extended to 60, that 21-day lockdown was announced at 3.5 hours notice, less than 4 hours notice. And the problem with that was not just the fact that many of us are frustrated by the Prime Minister's penchant for shock and awe, the dramatic announcement, demonetization of 86% of the currency in 2016 with just 4 hours notice as well. But it was also the fact that a lot of people could have used the time to plan better. An example being employers, many of whose workers slept on factory floors. And suddenly they found themselves not only shutting their factories overnight, thereby depriving their workers of jobs, but also depriving their workers of a roof under which to sleep. We had situations in which migrant workers, and a large number of Indians, somewhere in the rough estimate in the tens of millions, are migrant workers, many of whom wanted to go back home. And all the trains, planes, interstate buses were all shut down with the lockdown. So they couldn't do that either. We had a huge preventable human tragedy on the roads as people started trudging the empty highways to get back home because they simply couldn't afford to live where they were, had no place to live and no food to eat. Now, these are the kinds of things that could have been prevented. There's also been, unfortunately, none of the assurances that you people in Britain have had. I was impressed that the Chancellor of the Exchequer in Britain guaranteed 80% of the wages of those of employees, provided the employers committed not to fire them. Nothing like that in India, and so large numbers of people have indeed been fired. Our employment rate, which was already the worst in 45 years at over 7%, has now shot up over 27%, and many people unofficially estimate the real figure to be closer to 40%. This is a catastrophe. So we have a lot to say about an unplanned lockdown, hastily announced without adequate relief measures in a country notoriously missing a social security safety net. But on top of that, we also have the concern that now the lockdown is being lifted without planning as well. So when the lockdown was initially imposed, we had 500 COVID cases, and there was a real concern that it was spreading. Today, we have 150,000 plus, and each day breaks the previous day's record for the largest number of cases in a single day. And in those circumstances, the kind of return to normalcy we are seeing, largely because the lockdown has been economically unsustainable, is likely to create a situation that is medically unsustainable. We're likely to see, I'm sorry to say, our hospitals are simply unable to cope with the likely burden of infections the way they are going right now. We are behind the rest of Europe, much of the rest of the world in terms of when we got the virus seriously. We're also behind the rest of Europe in things like seeing the curve come down. Kerala, again, is an outlier, so don't generalize from Kerala. In India as a whole, the curve is still going up. So we haven't reached the point where we can say we've peaked and are coming down. And because we can't say that, we don't really know when the curve is going to end. And in these circumstances, to have people going out to the markets, to the shops, to businesses, often either not wearing masks or treating the masks rather casually, and certainly not observing physical distancing, all of this causes enormous concern. So India is in bad shape, and I worry it may get worse.
Shashi, you've written a great summary of the Kerala model for Project Syndicate, which very much informed my summary of 5 points, which I described up front. What else would you add to the minister's remarks?
Well, I think just a couple of things for context. I'm not sure if all your audience already knows this, but one of the remarkable things about Kerala is that it actually would have been, in theory, perhaps the most vulnerable state, because it is not only amongst the most densely populated states in the country, but something like about 17% of its population work outside Kerala. So, and plus, because tourism is a major source of revenue, it gets about 1 million foreign tourists a year, which means that this is a state which by rights will find it much more difficult to control viruses and other things coming in, because people are coming in and out all the time. And what's interesting is that despite that, Kerala was able to come through with flying colors despite this extraordinary mobility. And one thing that you have already mentioned in your list, I did think you had read my piece, so I'm glad to see that's true. But one thing you could make a little more of, I think, is the way in which the legacy and practice of decentralized governance in the state has meant that right at the grassroots level, we are seeing a tremendous amount of effective communication, public trust, and ground level responses. One interesting example is the migrant workers. Now, in every state in India, the migrant workers took to the streets, the roads, the highways, and created a huge crisis. Kerala is the only state in which more than 90% of the migrant workers opted not to go, because they were assured shelter, they were assured 3 meals a day and a bit of pocket money. And many of us were pressed into service. I was asked by a leading media house to record messages in Hindi and Bengali to the migrant workers whose mother tongues are those 2 languages, urging them not to go and that they would be taken care of, and that we in Kerala would take responsibility for them. So all of this was so well done that we didn't have this problem. Look at things like the fact that early on, when Kerala, before India had even declared a lockdown, but Kerala had declared a state health emergency already in February, what happened was that some people were ordered to stay in home quarantine who had no one to bring them essential supplies. And Indians were astonished to see media stories and photographs and videos of policemen bringing essential supplies to the doorsteps of the afflicted. I mean, I'm sorry to say, in much of the rest of India, policemen are pictured mainly wielding the batons, the lathis, which since the British colonial days, they have been taught to keep the errant masses in line with. They're not used to the idea of police performing a public service, and in this case, a private service to individuals. But that's what they did in Kerala, and I was incredibly impressed with that. And I've expressed on social media a lot of my appreciation to the police for doing that sort of thing. And I must say that these are the kinds of little touches that you don't really see in much of the rest of India. And I would say that as a proud Indian, that I think my compatriots have a lot to learn from this little southwestern state that has done so incredibly well.
Shashi, as a former Under-Secretary General of the United Nations, I can't resist asking you a question about the multilateral context of this pandemic. The World Health Organization, as you know, has increasingly become a political football, but it was previously arguably the least controversial of the multilateral bodies and has had notable successes with defeating smallpox, fighting polio, and tuberculosis. How does the WHO restore its credibility?
It is a challenge, because I mean, one of the problems to begin with is that it's not really the fault of WHO. It's the fault of the global system as a whole. And it doesn't make me very popular with my old UN colleagues to say this, but the entire international system has indeed been quite deliberately designed by the powerful powers in the world to ensure that the system responds to the wishes of these most powerful states. As a practical proposition, having worked very closely with Secretary General Kofi Annan, I can tell you that I know that it would have been inconceivable for him to repeatedly challenge the 5 permanent members of the Security Council. He had to work with them. As he rather memorably told me in citing a Ghanaian proverb, he said, his father had told him, never hit a man on the head when you've got your fingers between his teeth. And that is the situation of every head of every UN agency with a powerful member state, whether it's the US or China. Your fingers are between their teeth. And if you start hitting them on the head for what they're not doing right, because you take your autonomy very seriously, you are likely to get your fingers bitten off. That's a genuine challenge that many agency heads face. And I don't think it's entirely fair to blame the World Health Organization for doing exactly what it was designed to do, which is to respond and be responsive to the wishes of the powerful countries that are its principal financiers and call the shots in it. Having said that, there are a few things that can be done. I think institutionally, member states could agree on new protocols that would, for example, ensure that an independent decision by the WHO to inspect the site of a suspected health emergency cannot be prevented by the host state on any grounds. Currently, I am told by reliable sources that the Chinese simply didn't grant visas when the WHO wanted to send a team to Wuhan in the second week of January. Some would say the second week of January was already too late, but nonetheless, they did apparently make an effort, and they were not given visas by the Chinese. Now, that sort of thing ought not to be possible if you really want an independent WHO. Another thing that could be done would be, I think, to reform the WHO and all the other organizations to ensure that their executive heads are just given one longer, non-renewable term, rather than putting them in the invidious position of constantly currying favor with the countries that can ensure their longevity in a post. The very, very few secretaries general or directors general or heads of executive agencies who have spoken out of turn from the point of view of powerful member states have been. You really have one term, a 6-year term or a 7-year term, and that's it. Once you're elected, you could act without fear or favor. And I think that's an idea that really needs to be taken on board. The challenge, the real question that comes up, though, is, do member states have the stomach for this? Mr. Trump's famous broadside, and is even threatening to pull the US out of the WHO over its what he called its failed response, rather begs the question: what is the WHO to do? The organizations of the UN system are creations of member states, and decisions cannot be made independent of the wishes of member states. So when Mr. Trump says, and I quote, if the WHO does not commit to major substantive improvements within the next 30 days, I will make my temporary freeze of US funding permanent and reconsider our membership. That was his quote. And the fact is that, how can the WHO commit to anything by itself, because anything it can commit to would require the consent of member states? So that, I think, is the key to this answer. What are member states prepared to see done, and what are they prepared to do themselves or to agree to themselves?
Okay. Now, I probably want to now just turn to both of you, and the most common question that we received in advance is this: can the Kerala model be replicated and scaled across India, or indeed the world, and what obstacles would this face? Who wants to take that first?
I cannot say that Kerala model can replicate in other states, because over the year we are preparing to this people-centered planning here, and we have a basement for action here. And I don't know what is the condition in the villages of other states in India, and it is not easy to replicate these things. It is not very easy to replicate this thing to other part of the other states in India. But something is in common that I mentioned here. Some activities, like when Maharashtra Health Minister asked me, what are you doing there in slums? We are afraid of this Dharavi, and it is spreading in Maharashtra. And I said that there is only one thing to listen, that you should close that part, that Dharavi. It is not very easy. Millions of people are living there in that huge city. And if you close that city properly, but closing doesn't means not entering and exit, but also we have to supply foods, medicines and everything to that part. And to cut the spreading outside, that is the most important thing. We are doing that. If in a village, if there is 2 or 3 positive cases, we are declaring it as a containment area. And that containment area, we are closing everything. We are not allowing people to move outside and inside. But we are doing some field work there. Our health workers and also our local self-government people's representatives, they are going in front of their home and they are asking if you need anything, some medicines or any need. They are addressing their need. And that way only we can address the problem. Closing everything and abandoning the people for their fate, that doesn't make any result. But we have to close that part and we have to nurse them, we have to assist them properly. That is the thing, that every part of the world, this thing we can experiment with this idea. That is one thing. And in our case, in Kerala, the 70% of the positive cases are imported cases. And more than in India, 70% of cases is imported cases, and contact cases are arising from that. It is like 30%, etc. To maintain it, that is the most important thing. I think in Kerala, the transfer is very less. But throughout India, if we examine, the contact cases are increasing now. That is the great threat. And this is the method. And if we can implement that. And also one thing I want to state, the most vulnerable part. We are focusing on that part, old ages, differently abled, and transgenders, etc. And we are implementing reverse quarantine here. We are looking after them properly. And with the help of my social justice department, with the local level workers, we are addressing their needs also. We are supplying medicines, non-communicable disease medicine, to their doorsteps. And we are calling them morning and evening. Our volunteers are calling them, whether they have any problem. And we are separating these vulnerable persons from the suspected cases and from the positive cases. That way, we are trying to reduce the mortality rate, because if it goes to the vulnerable part, the mortality rate will increase. And we are nursing them properly, we are addressing them properly. That is the method. And 70% of the cases in India is confined to 11 municipal areas in India. We can say so. If we properly close that area and properly giving assistance to that place, I think from Kerala, I can say that we can tackle the problem and we can flatten the curve. That is the most important thing. That way the whole world should think. I think in USA itself, the first part, they didn't listen to the this kind of things, open to all. And it spreaded more than anything. After that, they started testing, tracing and other thing. When it go away from our hand, nothing we can do at that time. From the first part itself, we should place it in our hand and we should act properly. And that we are doing in Kerala. Without losing any opportunity, we are conducting every activities together. We are planning well and preparing well and acting well. That is the thing.
Bravo. Shashi, I don't know if you had anything to add.
Well, I think she's given you such a good and comprehensive answer, but in many ways it points to the challenge for the rest of India, because a lot of what she's talked about has been really built up over generations in Kerala. We have a different culture, as it were, There's been a tremendous emphasis on human development and putting money into healthcare, putting money into the public health infrastructure, in having devoted local level administration, all of which, frankly, is not universally found, let me put it politely, in all parts of India. So though Kerala has very clearly shown us a way forward that others would do well to emulate, it is far from certain that states coming from a different political culture and a different level of emphasis on some of the same things will necessarily do that. It's no accident that Kerala has the best human development indicators in India. And that, I think, is going to be a challenge for others to follow because other states have emphasized other things.
We're rapidly running out of time, but if you don't mind, and we can take literally just a few minutes, I wanted to just have a closing question, which just lifts us maybe a little bit, lifts our horizons. If there's a silver lining to this human tragedy, then it comes from accelerating certain trends, such as the use of technology, bringing the future closer, also welcome byproducts such as cleaner air quality through reduced pollution. What lasting impacts do you see coronavirus having on India and the world?
Is that for me?
But for both of you,
that
yes.
way we can give the minister the last word. So I'll go first. Just to say that I think that there's certainly going to be an incredibly important change in awareness. Number one, awareness of the importance of public health. I mean, I think it's a national disgrace that we only spend 1.28% of our GDP on health. And that needs to change absolutely imperatively. And I think many more politicians. I've chaired roundtables for 3 or 4 years now saying, why is it that public health is not more of a priority politically? And the short answer is that no politician goes back to their constituency and wins or loses votes because of public health issues. I think with COVID that will change. And I think the voters will be far more conscious of the importance of public health, and they will demand that their elected representatives should put more resources into public health, as Kerala has been doing, but even perhaps more. Second thing is, I hope, a consciousness of the environment. People have been blissfully surprised by what clean air has resulted from the lockdown. That in Delhi, you can actually see blue skies and wisps of clouds and breathe, whereas we were the most polluted city on the planet till 2 months ago. In parts of Punjab, they're able to see the Himalayas for the first time in living memory. All of these things have woken up people to what they are losing by business as usual. And so their argument and their commitment, I hope, to being able to not lose all that forever may also create an improved public health awareness. At the white collar level, I think there may well be some more emphasis on virtual conferencing, on working from home, on using videos. In turn, the government will need to do much more to open up broadband. Currently, India is rather poorly ranked on a list of the world's broadband facilities in terms of depth and range and speed of broadband. If we can get that up there, a lot more people, I think, are going to be able to benefit from working in these flexible ways rather than congesting our cities and congesting our roads. So all of that too could be transformative. So I think there could be some positive change, but of course we must not forget that in the process of getting to that a lot of human beings have paid a very terrible price. Lives have been lost both to the virus and to the lockdown. Human beings have been displaced and made to suffer terribly. A number of patterns of life and work have been disrupted. Many, for example, many migrant workers who left say they will not go back because they've lost that bond of trust. They will be looked after where they go back. All of these things will take some healing and some repairing to be done as well. So I don't want, in giving you the answer you want of a positive trend, I don't want to sound complacent or indifferent to the plight of so many millions of my countrymen and women who have suffered. But the fight goes on. I think what Shailaja has been talking about in Kerala is exemplary, but others are also working in other parts of the country and elsewhere to try and meet the problems and challenges that Indians nationwide are facing. And I think we all stand shoulder to shoulder, as she rightly said, against the virus, we are all united. Then elections will come around and we'll all be carping at each other. But against the virus, it's a common public interest, and we must stand together for that. And today, it so happens my party has led a virtual media campaign. I'll just take 1 minute to summarize our main demands, which have come together from a number of requests received from the public around the country. Number one is to provide transportation to the remaining migrant workers still struggling to get home on the highways, free transportation. Second, we have the National Rural Employment Guarantee Scheme named for Mahatma Gandhi, a request to double the number of days of such work permitted so people have some employment once they get back to their home villages and they can afford to eat. Third, to transfer 10,000 rupees, which is about £1,000, I beg your pardon, is about £100, to every poor family. That is, we have a below the poverty line category. Everybody in that has what's called Jan Dhan bank accounts. Give them money so that nobody is going to starve. And finally, give grants rather than loans to the small and micro enterprises of 2 people, 10 people, 20 people, small numbers of employees who are all facing extinction in the course of 2 months of lockdown. If we can do all that and cater to the most poor and vulnerable segments of our society, then we've at least protected our base as we look forward to the good things that we just talked about in the future.
Thank you, Shashi. You highlight quite rightly the economic challenges ahead, not just for India, but in fact for many countries around the world. Minister Shailaja, the final word to you.
Yes, sir. I think from every challenges, we got some positive points for further action. Some behavior changes in the society. And we have to think some further action points, such as in our country, the investment in public health is only 1% of the GDP. We have to increase the investment in the public health sector, especially for the primary healthcare system. And we should have to increase it to up to 10%, or some countries are remitting more than that. And we have to raise that amount in the public health, for public health activities. In Kerala, we are spending 3% to 5% in public health system. That is the one point. That lesson we got from this this pandemic tackling thing. And also we should give more focus on sustainable development. That is the most important thing. And we should to look for a future, more bright future, and to plan for a more bright future. Here we are implementing in every sector, especially in health sector, we have some projects, not only for 2020 or 2021. It is for 2030 and after that. Some projects, we are running that projects here. We have a mission called Ardram in Kerala, in which we want to make all the public hospitals patient friendly, not only patient friendly, but also high-tech. And that planning is for 2030 and 2040, etc. We started that planning here. We started the work here. And this pandemic also shows to improve our health system more than anything. That is one of the positive point we got. And the health behavior in people, to maintain personal hygiene, to maintain public health system and also public hygiene, etc. Institutional hygiene is the most important thing. Now we are trying to reduce the hospital-based infections. We got some awards for that for some hospitals. We are trying hard to reduce the hospital-based infection. That kind of thing we have to give focus, and decentralized health policy. Health delivery should be there, and we should draft policies for that, for decentralized planning. We have a very good health policy here. We introduced that people-centered policy here, and I am not elaborating. This kind of lessons are teaching, or we are learning some lessons from this pandemic, and the virus will come again, another kind of virus. But we should be aware, virus are there in the universe, and they are with us. We have to live with that virus. How to live with the virus? That is the most important thing. We have to learn how to live with the invisible enemy. how to tackle the problem, how to live with this enemy, how to contain it, and how to keep away from it, and how to restrict the entrance of this kind of pathogens to our body. And if it entered our body, what is the capacity of our body to resist it? We have to increase the immunity of our body, the human beings. That is the thing. So many researches are going on, and I think there will be a solution. There will be a vaccination, or the people will find out a vaccine or something like that for this virus also. And now we are living with this virus, and it teaches several lessons to the human beings, how to behave, how to live. That is the lesson. That points we have to take into care.
So it's great to be able to conclude on that more hopeful, slightly more positive note. This has been a fantastic and timely discussion, as the many comments in the chat room have shown. Thank you both Minister Shailaja and Shashi Tharoor for sharing your insights and taking your valuable time to speak to us today on today's webinar. We wish you continued success with the Kerala model, and indeed in spreading this best practice across India and sharing your experiences with the world. Wishing everyone continued good health. Please stay safe, and handing back to Richard Hawkes, the CEO of the British Asian Trust, to conclude.
Thank you very much indeed, Jitesh. And I'd just like to reiterate my thanks and gratitude to our two fantastic special guests, Minister Shailaja and Mr. Shashi Tharoor, for finding the time to join the British Asian Trust today. And also, obviously, to Lord Gadhia for leading us through such a fascinating discussion. Those of you who know me know how much I personally love India. I think I've had the privilege of visiting the country on more than 40 occasions altogether. 2 years ago, I had the great privilege of spending a week in Kerala for the first time. And without question, it is one of the most beautiful places I've ever been to. It's so pleasing to know that a place so beautiful can also be so successful when dealing with the crisis that the world now faces. And I very much hope that my own country, the UK, and many other countries can learn from the example that you're setting. At the British Asian Trust, we're deeply concerned about the impact of COVID-19 on people living in poverty. Across the countries of South Asia, there are millions of people whose lives are being totally turned upside down by this pandemic, as we've heard today. The impact on the economy is absolutely devastating. Hundreds of millions of people have lost their jobs and therefore have no money to feed themselves and their families. And this is why 4 weeks ago, His Royal Highness the Prince of Wales launched an emergency appeal for South Asia with the following video message.
Ladies and gentlemen, the current public health crisis is a challenge which confronts us all in every community and in every part of the world. In the United Kingdom, I know that the British Asian community is playing a vital role in the response to this crisis, whether in the NHS or as key workers in other roles, or through the wonderful work being done by volunteers and local initiatives through temples, mosques and gurdwaras to support all members of all communities. I know too that the British Asian community is deeply concerned about the welfare and well-being of people in South Asia, where this pernicious virus and the disruption it causes is having such a profound effect on the lives and livelihoods of millions. With this in mind, as the royal founding patron of the British Asian Trust, I wanted to lend my support to the launch of an emergency appeal to help those who are suffering most across India, Pakistan, Bangladesh and Sri Lanka. I started the British Asian Trust 13 years ago with the help of members of the British Asian community to support those in greatest need in South Asia. Over this time, the Trust has supported nearly 5 million people. Today, to play its part in responding to this pandemic, the British Asian Trust, in partnership with local organisations and governments, is ramping up its work to support the daily basic needs of the poorest and the most vulnerable. Across the region, an estimated 40 million children are in need. Over 400 million daily workers have seen their livelihoods disappear with no form of income and no savings. And they and their families now face a fight for survival. The British Asian Trust's COVID emergency appeal will support those in India, Pakistan, Bangladesh and Sri Lanka who need it most. With your generosity, ladies and gentlemen, the British Asian Trust will help those who have nowhere else to turn and offer hope to those who face the most desperate circumstances. With your help, we can make a difference. I need hardly say how deeply grateful I will be for your generous support.
We are extremely honoured to have the support of His Royal Highness, and I'm absolutely delighted to be letting you know that our appeal in less than 4 weeks has now raised almost £1 million. But we know that we need to keep raising more, and in the weeks and months ahead, that is exactly what we're going to be doing, raising more money to support our partner organisations doing so much incredible work across the South Asian region. Thank you all once again, very much indeed. Thank you so much to our tremendous panelists for this morning, for today. And thank you all for participating and for your interest in the British Asian Trust. Thank you and goodbye.